Hi everyone, my name is Damaris Martinez and I am currently working at a freestanding emergency department. I would probably say that in context of the emergency rooms, the sacred cow issues refer to longstanding practices, beliefs, or protocols that are treated as untouchable or beyond scrutiny even if they may be even if they may not be the most effective or evidence-based. The sacred cow that I would say that affects most emergency room departments is the over reliance on opioids for pain management. The treatment of pain in the ER is a delicate issue with long-standing practices around prescribing narcotics in acute pain scenarios. While pain management is an essential aspect of care, the opioid crisis has brought increased scrutiny to the prescribing practices in emergency room. The sacred cow here is that the belief that opioids should be the go-to treatment for pain, despite mounting evidence advocating for more responsible prescribing and alternative treatments. The nature of opioids prescribing in the ER stems from several factors. Patient expectations. Patients often arrive to the ER seeking quick and effective relief from severe pain, and opioids have long been associated with rapid pain resolution. In some cases, patients even demand opioids, making it even harder for healthcare providers to explore alternative options. There's also historical and medical training. Many healthcare providers were trained in an era where opioids were considered a gold standard for acute pain management. And this created a default mindset in the ER setting that opioids are the best or only solution for certain types of pain. And then there's also a lack of immediate alternative. In emergency room settings, time is of the essence. Medical staff may feel pressured to provide the quickest and the most effective solution to alleviate pain, and opioids often seem like the easiest choice. So, I mean, what do we do? There's shifting of perspective in pain management. So there is a growing body of evidence that suggests the reliance on opioids for acute pain in the ER setting should be re-examined. Healthcare providers are increasingly aware of the risk associated with opioids and are advocating for more responsible prescribing practices, which include using alternative methods of pain management and limiting opioid prescribed when possible. Some alternative approaches to opioids uses include like non-opioids medication, for example, acetaminophen, ibuprofen, NSAIDs, combining that to combat, moderate pain and helping combined with other non-pharmacologic interventions for more severe pain can be quite proven effective. Then there's also local anesthesia and nerve blocks. So, for pain associated with specific injuries like fractures or wounds, local anesthetics and nerve blocks can provide targeted pain relief with fewer systemic side effects than opioids. And then there's also our nursing interventions, which are non-pharmacological pain relief methods such as ice, heat, elevation, massage, physical therapy. All this can reduce pain and improve comfort without medication. So, one thing that we have is like the barriers to change, Despite with these alternative options, there are several barriers that hinder the widespread adoption of opioid-sparing approaches in the ER. And some of those barriers, for example, is like cultural resistance. The use of opioids have been ingrained in the medical culture for so long that even well-intended healthcare providers can feel a strong resistance to change. Opioids are often seen as a quick fix in a fast-paced, high-stress environment where immediate pain relief is prioritized. And then there's also patient expectation. Patients who have come to expect opioids for pain relief may not be so receptive to alternative methods. And we see this a lot, though. We have in the ER that we have these patients who are frequent flyers that we know that they're just coming in because they want to have their quick fix. And unfortunately, because of the fear of patient dissatisfaction or complaints, if the opioids are not given, it leads to the pressure to the medical staff to prescribe them. And then there's time. ER providers are under pressure to make rapid decisions and address pain quickly. And the time it takes to explain the risk of opioids, offer alternative, and monitor the effectiveness can be seen as an inconvenience in a busy ER. Like, you just want to, see the patient, go, give them pain, go, Especially when opioids administration has been viewed as the fastest option, that's the options that's going to be taken. So efforts to address the issue. As awareness of opioids crisis grows, efforts are being made to reduce opioids prescribing in emergency rooms. So there's prescription guidelines. Many healthcare institutions have implemented guidelines for opioids prescribing, emphasizing in lower doses, shorter durations, and focus on non-opioids treatment when possible. So patients are getting like a lower doses, or just getting like a couple of days at a time versus having like a whole month supply of medication. And then there's education and training. Providers are being trained to assess pain more holistically and to consider the risk of opioid prescription before offering them. This training also includes guidance on how to discuss alternative pain management options with patients. And then there's this also, it's called eForce, and it's like a state level program that allows prescribers to track patients' prescriptions to avoid duplicate and excessive prescriptions, because that is something also that we see that patients are going, jumping from ER or from provider to provider, and they're getting their medications, and it was something that's not being tracked. So now with this prescription drug monitoring program, it makes it easier for the physicians to see what has been prescribed recently for the patients. And then there's also one other tactic that can be used is the use of multidisciplinary teams. Some hospitals are employing pain specialists, pharmacists, and advanced practice providers to work alongside the ER teams to explore non-opioid pain management options. So in conclusion, the issue of pain management and opioids use in the ER represents a sacred cow that must be reevaluated in the context of the opioid crisis. While opioids have been the cornerstone of acute pain relief in emergency medicine, the mounting evidence of their role in fueling addiction and overdose deaths requires a shift. And this is something it's really scary. So it's definitely something that we need to, by exploring and implementing alternative evidence-based pain management strategies, ER providers can address both the immediate pain of their patients and the long-term health consequences of overprescribing opioids. This evaluation will require a cultural shift, ongoing education, and collaboration. But it is an essential step towards improving patient safety and public health in the ER. I also would like to invite Maria Lombo, that I know she works at a step-down unit. Chanel Messidou, I did listen to your video as well, and I know that you just speak about morphine and the cardiac department, and it was very interesting. But if you can, invite you to watch my video as well, and then you can see how the opioid crisis can affect throughout all nursing care. Okay. Thank you very much.